Good morning, everyone, and happy Sunday. So shout out again to all the anniversary couples celebrating the anniversary. Special shout out to my best friend, Faye, and her husband, Carlton. They celebrated 34 years of their wedding anniversary. So congratulations to both of them. Love and appreciate both of you so much, and I wish you many more. So, as requested, I'm not going to say who requested it. The topic for today is on ingrown toenails. So what is an ingrown toenail? An ingrown toenail is a foot condition that develops when the corner of your toenail grows down into your skin. It usually affects your big toe, but it can affect any of your toes, really. The condition often happens again when people cut your toenails by rounding, tapering the corner of their nails. If the toenail curves with the shape of your toe, it can grow into your skin. Ingrown toenails are common and don't usually pose a health risk to healthy people. So what are some of the symptoms of ingrown toenails? Ingrown toenail symptoms include pain and tenderness, inflamed skin, and swelling. If the ingrown toenail is infected, the symptoms of that include liquid or pus coming out of your toe. You will have pain as well, redness or darkening of the area, swelling, or toe feeling warm or hot. So what causes ingrown toenail? So here's a picture over here of an infected one. If you're able to see, it's the right to my right, probably to your left. Ingrown toenails can have many causes. These may include incorrectly cut toenails. If you cut your toenail too short or rounded, the nail again may grow into your skin. Improperly fitting shoes. Tearing the corner of your nail. Toe trauma, such as banging your toe or getting stepped on. Your toe shaped. For instance, if your toe is larger comparatively with other toes, or the surrounding tissue of the nail border naturally grows around your nail, will naturally grow around your nail. A mild ingrown toenail can feel hard, tender, and swollen. If the nail grows into your skin or the skin grows over your nail edge, bacteria can enter and the nail bed can become infected. So who is likely to have ingrown toenails? Anyone can get ingrown toenail. People at higher risk include adolescents, when feet tend to perspire more, which softens the nail and skin. Athletes and people who have diabetes that causes poor blood flow, severe nerve damage to their leg or foot, poor blood circulation, and a nail infection, having a reduced ability to care for your nails, wearing shoes that constrict the toes, and participating in activities such as running and kicking that put your toes at risk for injury. So how are ingrown toenails diagnosed? You can often diagnose the condition yourself based on your symptoms and how your toe looks and feels. Your healthcare provider, which may be your regular provider or a foot specialist called a podiatrist, will likely diagnose an ingrown toenail by inspecting it. They'll examine the skin at the edge of your nail. They'll diagnose you with this foot condition if the skin is growing over your nail, swollen, tender, warm, and red or darker in color, painful to light touch, and looks different than your other toes. So let's talk about some home management and treatment of ingrown toenails. I'm going to talk about some home management, and then we'll talk about some surgical treatments as well. Ingrown toenail home treatment includes several simple steps. These steps can help manage the infection and prevent further ingrown toenails, especially if you have one. You want to soak your foot in warm water mixed with Epsom salt or soapy sooty water twice daily. Keep your foot dry the rest of the time. Gently lift the edge of your nail. Place a small piece of cotton between the nail and your skin. You can also use dental floss under the ingrown toenail. Change the cotton or floss every day. This will help your nail grow above the edge of your skin. Use an antibiotic cream and a bandage. Wear roomy shoes or sandals. Use pain relievers such as ibuprofen or acetaminophen, so that's Motrin or Tylenol if needed. If you have signs of infection or a severe ingrown toenail, don't attempt to cut it yourself. I don't advise that. If you cut the nail, the condition may get worse. If symptoms aren't getting better with home remedies for an ingrown toenail, you want to make sure you see a healthcare provider about that. There's also surgical treatments. If excessive inflammation, swelling, pain, and discharge are present, the toenail is probably infected and should be treated by a physician. You may need to take oral antibiotics, and the nail may need to be partially or completely removed. The doctor can surgically remove a portion of the nail, a portion of the underlying nail bed, some of the adjacent soft tissue, and even a part of the growth center. Surgery is effective in eliminating the nail edge from growing inward and cutting into the fleshy folds of the toenail. Permanent removal of the nail may be advised for children with chronic, recurrent, infected, ingrown toenails. If you are in a lot of pain or the infection keeps coming back, your doctor may remove part of your ingrown toenail, which is called a partial nail avulsion. And this is what it actually looks like. So how can we prevent ingrown toenails? You can take these steps to prevent an ingrown toenail. Soak your nails in warm water before cutting them, or cut your nails after a shower or bath. Clean your nail trimmer before using it. Don't tear or rip your nails. Trim your toenails across, so left of my screen. This is how you're supposed to be cutting your nails, not this way. So you want to trim the toenails across, don't round the corners. Wear shoes that fit correctly. They shouldn't be too loose or too tight around your toes. Avoid repetitive trauma to the sides of your nails. If you have diabetes, follow all foot care recommendations by your healthcare provider. Don't be hesitant about seeking medical help. A reminder, an ingrown toenail, it is annoying and painful, but very treatable. Often soaking your nail will improve symptoms with a few days. If it doesn't get better, see your healthcare provider. They'll show you how to treat an ingrown toenail. To prevent this condition, again, wear roomy shoes and cut your nails straight across rather than tapering them to the shape of your toe. A lot of people like to do that for some reason. Ingrown toenails should be treated as soon as they are recognized. If they are recognized early before infection sets in, home care may prevent the need for further treatment. I want to give special acknowledgement to OrthoInfo, AOS, Mayo Clinic, and Cleveland Clinic for the information that I provided you for today. I hope it was helpful, especially for the person that asked for this topic. But should you have any questions, please join us in the Zoom room immediately after service, where I'll be happy to answer those questions for you. Thank you for your time. God bless you and enjoy the rest of the service.